FSH. Now it is the time of the second hormone, just few days before ovulation. Few days before ovulation, LH is coming, and LH is producing locally a new hormone also now, and that hormone is progesterone. Yani progesterone is maujood before ovulation. You need progesterone for ovulation. Progesterone, if it is not there, LH cannot do anything. It means LH is coming, but LH is using locally a special thing for the ovulation. Progesterone is the local worker, and the controller is LH. So LH is the controlling factor, the main factor, but actually the worker, the main job locally is done by progesterone. Okay, progesterone. Now let us see what is progesterone doing, please. That is very important. Progesterone is stimulating some very important thing, some special enzymes and some growth factors, and it is increasing the blood flow inside the follicle. Okay, if you are increasing the blood flow inside the follicle, what will happen? Okay, more secretion of the fluid, and the ball becomes more tight and tight and tight, yani more antral fluid. Okay, if you are producing some special enzymes like collagenase or some proteolytic enzymes, they will start eating up and destroying the theca externa, okay, weakening the wall, like removing it. Inside the fluid is maujood, okay, and you are also removing, by using the enzymes, you are removing the wall or you are weakening the wall. So when the pressure is developing and the wall is becoming weakened and weakened, because there is secretion of local prostaglandins, secretion of collagenases and other enzymes, digestive enzymes, and they will start eating up the inside of the follicle. So the wall of the follicle will become weaker and weaker, and from inside, basically. From inside it starts working, okay? So the wall is gradually weakening, okay? And the fluid is increasing and the pressure is building up. So maybe there is one point. In this area, for example, there is more weakening. In this area there is less weakening. In the surrounding area, less weakening. This area is becoming more weak and the pressure is increasing. So what will happen? This area is the focus, and this area is vulnerable to rupture easily. So one point develops as a weak point, and when the pressure becomes immense, all of a sudden that area ruptures because of great amount of fluid and the pressure of the fluid and the weakness of the wall. So that moment, the fluid gushes outside along with the cumulus ophorus, and that process is known as ovulation. Okay, it takes few seconds. So the whole job is done by progesterone. Progesterone is increasing prostaglandins. Progesterone is producing some other growth factors and some vasodilators. Progesterone is also increasing the digestive enzymes like collagenases and some other proteolytic enzymes, and all are working together and they are trying to weaken the wall of the follicle. Okay, you're getting it? So final result is follicular rupture and release. This is called the ovulation process. All right, we are done. Ovulation happens. Now after ovulation, please, very quickly, it is the luteal phase or the post-ovulatory phase. Okay, that has happened. Now the remaining mass is stimulated by the LH. Now the main controller is LH. FSH is also working, I'm not saying that, but LH is now the main controller, and because of the LH there are changes in this structure, remaining structure of the follicle, and it turns into a yellow lipid-like body because lots of lipids are there, and that mass is known as corpus luteum. It has a very special characteristics of secreting two hormones, and it requires only a very low amount of LH. For the maintenance of the corpus luteum, you don't require a very high amount of LH, little amount. Why do you require a little amount of LH? Receptors are kathir in number, okay? So even a little amount is good. There is no problem. Perfect, okay? So corpus luteum will develop and it will keep on secreting, okay? Ovulation, I'll come to the ovulation, and let me go to one diagram at the end, and I just, okay. Let us go to this diagram. Have a look at the diagram. Okay, now we have seen Okay, now you have to focus, please. Look at these two diagrams, Shabab. Now please be careful. Be very careful. Don't look at this part of the diagram. We are not doing that. Don't look at this uterine cycle. We are not doing that. We are running between the hormones. FSH, LH, estrogen, progesterone. This is what we have discussed so far, okay? The follicle growth phases and what is happening to the hormones. So we are still playing between the hormones right now, okay? Let us see graphically now what is happening, okay? Please, first of all, look at the follicle. Do you see the growing follicle from primordial follicle? You are starting primary and antral follicle develops and ovulation happens and then corpus luteum is formed. Do you see that? And then the corpus luteum becomes like a fibrous mass, atretic body. It dies and it shrinks at the end of the ovarian cycle. Last few days of the ovarian cycle, okay, you can see it turns into useless mass, corpus albicans, okay, white fibrotic mass, okay, it's gone. Now, look at the point of ovulation. This is dividing the cycle, okay, ovulation. This phase is, and this phase is, okay. So this phase is pre-ovulatory here. This is the line of division, please. This phase is the pre-ovulatory phase and this phase is the post, okay. So you are focusing, you know the division of the line. Your mind is oriented. Now you see, please, okay. When you are starting the cycle, okay, the cycle is starting from here. The cycle is of about 28 days, okay. If the ovarian cycle is 28 days, the uterine cycle will also be of 28 days because these two cycles, uterine cycle is like a reflection of the ovarian cycle. If ovarian cycle is happening for 28 days, the same will be the duration of uterine cycle. If it is for 30 days in a female, same expression of 30 days. If it is 35 days, 35 days. If it is 20 days, 20 days, whatever, okay. So it's well coordinated, same thing. Now please look at the hormones. First of all, look at the FSH and LH graph, okay, this graph, okay. Look at the run of the graph, first of all. You are starting the cycle from the day 0, day 1, 2, 3. If it's a 28-day cycle, usually we take 28 days for the cycle and the nus or the middle of the cycle is the time of ovulation. We usually believe that, okay. Mostly it happens like this. So day 14 is the time, okay, before and after. You are starting, look at the FSH and LH, okay. First of all, compare FSH and LH at the starting. Which one, when you are starting the follicle development, is it LH more or FSH more? There is a very little amount of LH modued in the blood. I am not saying that, okay, but definitely you need FSH more at that time. So FSH is higher, isn't it? These two are going. Now as you are going forward towards ovulation, what is happening to the graph of the FSH? It is elevating. FSH is going up, isn't it? Slightly. This graph is now increasing, isn't it? First, okay. And then after that, okay, it shows a little depression, slight depression or so, okay, a slight change, okay. And then just before ovulation, maybe like 1 day before ovulation or 12 hours or 16 hours or 18 hours before ovulation, all of a sudden there's a change. Oh, starts going up like this, okay, upshoot here. And then at ovulation, it is at its maximum, isn't it? And then after that, it will come down again and see. Now, you see that. Look at now the estrogen, FSH, and now look at the estrogen from here, the yellow line, okay, this line, okay. In the beginning, what is happening? When FSH is coming, what is happening? It is stimulating the secretion of the estrogen. But when a considerable amount of estrogen is modued, what is estrogen doing to the pituitary? Okay, and did you see the reason why your graph was coming down here? Because the estrogen was, so what do you call it, negative feedback or a positive feedback? Oh yeah, it is following a classical negative feedback, isn't it? Are you getting the time? This diagram, okay, as estrogen is significantly rising in the blood, at the same time, oh, it has to depress the pituitary, and this is a negative feedback control which is expressed, okay, relationship. All right, but somewhere at this point, what is happening to the, now look at the relationship. Here it is going up and here estrogen is going up. So what happens? Just before ovulation, this behavior of estrogen is changing for the FSH. Okay, it was causing negative feedback, but just before ovulation, it changes the behavior, a very mysterious process, and somehow pituitary behavior changes, and now FSH increases because of the increasing surge of the estrogen. Okay, so from this point, this is the negative feedback, isn't it here? Okay, but from this point, this is positive feedback. All right, this is the systemic positive feedback, not the local one. It is the systemic positive feedback which is happening. Okay. After that, okay, look at the FSH graph. Is it coming down or up? What happens? What is happening to the estrogen? So if you see the relationship between these two, again, is it a negative or a positive? So in most of the time, most of the places of the graph, you will see a negative relationship before and after. But in a very special time, before ovulation, really, before ovulation, what is happening? You will see the positive feedback. That's a very special thing which is happening. We still don't know about it, why it happens really. There is a change in the genetic code at that time. Some genes are stimulated, they change totally, and the same estrogen which was causing negative feedback is now causing the positive feedback from the pituitary. Okay? What is the exact reason? We are still trying to find out the reason, but yeah.
At time of ovulation.
Of ovulation, yeah.
FSH is at its maximum.
Yeah.
But the estrogen is declining.
Yeah. Yes, exactly. A little before, because this estrogen, this positive feedback of estrogen, okay, has done its job actually here. Okay, the hormone level will go up. But at this time, okay, just before ovulation, few hours before ovulation, okay, or a day before ovulation, at that day, this behavior of the feedback starts changing from a positive. So very short time for a positive feedback, only for few hours or maybe less than a day, and then again, even before ovulation or at the time of ovulation, is it a negative feedback or a positive feedback? Probably it changes back into the negative feedback at that time. Yeah, from that time. Okay, the behavior changes because the estrogen starts declining at this point and FSH is still going up. Okay, yeah, it is opposite now. Less estrogen will allow the FSH to go up. So negative changes to positive for a short time, and again after that positive again quickly changes to negative. But this is the period of your positive feedback here. It's going up to that level. Yeah, okay. This is a quick behavior change. Negative, positive, negative. It's coming like that, okay? But there is a definite positive feedback which is happening just before ovulation time. Remember that point, okay? And after that, taqriban, most of the time it follows. It's a very strange relationship. We are not very clear about that. But we see different events of negative feedback, then positive feedback, and then again coming to the negative feedback. Keep it in mind, broadly speaking, like this. Okay? Now, quickly, yes, dear.
Positive feedback is happening locally or systemically?
Well, this one for ovulation, for this graph, it is showing you the systemic. Okay? Before that time, local feedback is not shown in this diagram. Okay? This diagram is showing you the systemic feedback between the pituitary and the ovaries, like this. Okay? This is the axis diagram, hypothalamo pituitary gonadal axis, like this diagram. Okay, positive feedback was موجود in the ovaries locally, but this is not shown in this diagram. This diagram is systemic diagram. All right, are we clear? Are we not confused about FSH and estrogen? Clear? Now look at the LH, please. Look at the LH. What is happening? I'm not telling you anything. Just have a look at the LH graph. LH is running and running and running. You don't need LH for a long time. Just few days before ovulation, do you see a change in the LH behavior? Yes. Oh yeah, definitely it is there. And you see, and about 1 day or 24 hours or a little more than that, all of a sudden there is an explosive change in the LH behavior. So different, even much intense as compared to FSH. FSH is not like that. It's like going, graph is going up, and within 24 hours, or maybe less than 24 hours, it is going up. Actually, about 12 to 16 or 18 hours before the ovulation, this rapid change, a steep upward movement, lots of LH is coming into the blood, and it's going so high that you call it LH surge. Surge means intense secretion and a very quickly rising level of the LH, okay? So a true LH surge, look at the FSH. FSH is a small graph, isn't it? And look at the size of the LH. Well, LH is, if I see, well, multiple factors are helping in ovulation. Out of this graph, which one is the most impressive factor? Definitely LH. And if I ask you, is FSH also contributing to that? Yes. If I ask you, is estrogen also contributing to that? Yes. And will there be some contribution of the progesterone also if you see in the graph? Very little. But if you see bit tartib, the most important will be LH. The second will be FSH. And the third will be, and then you will have like this. So all are contributing to ovulation process. But the most important and the principal controller is, now you see the relationship between LH and progesterone. Is progesterone موجود from the beginning of the graph? In a high level of progesterone, is it موجود? No. Okay. There is a low level of the progesterone, okay, and that remains low. Estrogen was rising. After that, just a little time before, when the LH surge is starting, there is a change in the progesterone, a little change in the progesterone. You need a little amount of progesterone. Before ovulation, do you see a very high amount of progesterone? A very little. But this very little is very important, because if this very little is not there, what will not happen? No ovulation. Don't go on the graph. Look at the value of the progesterone. What is progesterone doing locally? If it is not موجود, LH cannot do anything really, okay? What will happen in a girl who is just starting the puberty? What do you expect regarding LH and FSH? Secretion, okay? Why is she having anovulatory cycles?
Because she had the hormones.
What is the reason? What is the hormonal reason? Okay, let's talk about the endocrine reason or the hormonal reason. Well, anovulatory cycle is there. Okay, we know that. Okay, mumkin yes, mumkin no. Okay, but why? Why anovulatory cycle? What is the failure cause? What is the cause of the failure? Hormones. Hormones? Which hormones? Okay. Yes. Okay. Initially, if you see the graph of that girl, maybe the FSH levels are like this. Little. Maybe the LH levels are like this. Bus. Okay. There is a change. But there is an improper secretion, little secretion or a deficient secretion of the hormones, and you need a good amount of hormones. One thing is hormones, and hormones are causing the receptor regulation also. So you will have less number of receptors maybe, and you will have less secretion of the hormone. Quality and quantity both are there, okay? Qualitative effect and the quantitative effect, and that's why maybe this combination does not work and ovulation fails actually, okay? So ovulation is trying to happen, but it fails, okay? And when the hormone secretion is good for the FSH and especially the LH surge, if you have a very good LH surge, ovulation occurs very perfectly, okay? So LH surge is the main cause, central cause of the ovulation, because if good LH surge is there, you expect a sufficient amount of progesterone to be formed. If LH and progesterone both are موجود satisfactorily, then you will have the ovulation. So there are problems in the LH and progesterone and mumkin other hormones also, which are preventing the ovulation in anovulatory cycles. All right? You're getting it? Okay. Look at the time after ovulation. What kind of a feedback do you see between progesterone and the LH? Progesterone, LH. Okay? What do you expect? Is it negative clearly? Generally speaking, in most of the time, it is negative. All right? Now, At the end of the cycle, please see what is happening at the end of the cycle. Here. Okay, no, first of all, what is happening? Look at estrogen and progesterone. What is happening to their level? Look at the corpus luteum. The last few days of corpus luteum, what is happening? Corpus albicans. Corpus luteum gone. What is happening to the estrogen? Because what is the source of estrogen and progesterone? Corpus luteum. Look at the corpus luteum. What has happened? Do you expect now the secretion of estrogen, progesterone, good secretion? So the secretion is falling. If the estrogen, progesterone secretion is falling, okay, now at that time, what is happening to the FSH and LH secretion? It means it is still following the negative feedback, all right? So every part, if you analyze, you will see, oh yeah, there is some kind of a negative feedback there, taqriban, okay, in most of the areas, isn't it? So you can analyze the graph and you can understand it, compare it, all right? Shabab, this is between the hormones and we are almost done with the ovarian cycle. It is finished. I'm stopping here because this is the point of saturation for all of you. I don't want to continue anymore for this one. Okay. I hope you have understood the basic fluctuations of the ovarian cycle, the relationship between the hormones, what is the positive feedback, what is the local positive feedback, what is the systemic positive feedback, when do you have the negative feedbacks in the cycle between the hormones. Okay? Did you get the ideas? Thank you very much. I'm staying for the attendance only, and